Right back in March, when we first realised the enormity of the COVID pandemic, we were talking regularly to local healthcare facilities through our clinician scientists and realising there was a really pressing need for more urgent testing to be done.
Lots of my colleagues at University College Hospital, frontline practicing clinicians, were becoming sick with COVID-like symptoms and not knowing what to do. Patients were also getting sick with typical COVID symptoms, and there was no testing available. So with the closure of the institute, it just seemed obvious that you would try to do something to help. And talking to Steve Gamblin and Sonia Gandhi, we decided to try to set up a COVID testing pipeline using the fantastic science skill set, people and kit available here at the Crick.
Steve Gamblin got me involved right at the start. There was a Zoom session with Charlie looking at what was possible right at the beginning, and then it sort of quickly snowballed from there. So that was on the Thursday. I was off on leave on the Friday. Actually, we'd booked to go away that weekend a while before, and I was walking out in the countryside somewhere and started getting phone calls from Steve Gamblin, and then it really went crazy after that.
It kind of all went into a bit of a blur from that point on. It was sort of all hands to the pump for the next couple of weeks.
When we first started, in all honesty, we didn't know if we were going to succeed. We were aware this was a major challenge. We're not a diagnostics institute, and the field of diagnostics is very different from the field of discovery science.
During that first week particularly, everything was in flux. So all the physical parts of the pipeline and how that was going to work were all changing. So we were trying to piece together a data framework around a process which was just all over the place and constantly moving.
It's been great to be involved because it's kind of a nice example of how everybody's kind of come together and joined together and worked. From that perspective, it's been hard but really, really rewarding.
My day-to-day role in non-pandemic times is as the head of the metabolomics lab at the Crick. It was quite clear early on in the pandemic that this was going to be quite a large operation, so I was asked to come in to help with some of the managerial aspects of the day-to-day operation of the pipeline. I still remember that very first day where we had got the pipeline completed, fully operational, and that first real sample went through. It gave me a real sense of purpose in what I was doing that I don't think I'd actually experienced in the rest of my scientific career. The Crick has been very lucky in setting up this pipeline, that they've had a number of very skilled individuals. Two of the people that I've been working most closely with would be Jerome Nickod of the Advanced Sequencing Facility, and also Mike Howell, who on a day-to-day basis runs the high throughput screening platform. Without those two people, I don't think this operation would have gotten off its feet.
You know, a metaphor here is Dunkirk, to be honest. We are a lot of little boats, and the little boats can be effective. Now the time is to get our shoulder behind the wheel and to do as much as we can to help everybody in this country.
There was a call to arms. We needed more people, and what was amazing was just to see how many people were willing to come in. They put down their work and they joined the fight with us, as so many of us were just willing to just do what we could to make sure that this pipeline was successful, because we knew at the end of the day, in our heart of hearts, we are all working in science to protect people. That's the fundamental underlying of why we are here.
What was amazing was how many Crick colleagues were able to take on jobs and volunteer to do things that were completely not in their area of expertise, but they were still up for it and had the energy to try. And I think it was that mindset of, it doesn't matter what I'm doing currently, I can help, that really made a difference.
So the people that are working in the science have gone into sample testing, and then following on from that, going on to our BRF staff who've been doing completely different jobs, and they've trained up fantastically and they've worked so hard. But also behind the scenes, for example, we're using something like 2,000 what's called pastettes a day, and so those had to be procured. But in the face of competition from lots of other people around the world, those people worked really hard just to get us the supply so that we could do it. If we didn't have the cleaners that came round and cleaned, the people in the restaurant gave us food at the weekends, enabled us to keep going. So there's a whole raft of people in the background that helped us get to where we are today.
The part of the pipeline that I work on was making buffers. At the start of the pandemic, the pre-made buffers were just not available to buy. So to give security to supply, the Crick brought in the raw materials and we started to make the buffers. It's extremely rewarding. Every day I find out how many samples we've tested, and every day I report that to the team. And we all know each tube gives somebody a result, and that is just incredibly rewarding.
Undoubtedly, this has been the most challenging project I've ever been involved in my scientific and clinical career. The success of the programme is due to the fact that we have had an enormously dedicated group of scientific staff really give up their lives for the last 6 months for the success of this pipeline.
I've called our lab a lifeboat lab, coming to the rescue. Local, voluntary, saving lives. Many say to me this is the best testing facility in the country, and it was set up in weeks by dedicated people taking it on, and everybody involved in that should be proud of what they've done.